Hey guys, it's Rose again. I am back to talk to you again about eating disorders, and today I thought I would start by explaining what an eating disorder is. And I was going to briefly cover the various types of eating disorders, but I realized that it would probably be more advantageous to you if I deep dive into each one at a time so that I can give you a little bit more information. So today I'm going to talk to you about anorexia. Now, what is an eating disorder? An eating disorder is a process addiction. So in other words, unlike addictions like obviously taking drugs or drinking alcohol, the high that you get from it is not from an external thing that changes your state of mind, but rather a process of something that you do or don't do that causes you to get your dopamine rush. So with anorexia, the process of starving yourself and restricting your food is what is the addictive thing. Now, there are a variety of different ways in which people may do this. That it may manifest in different ways. But essentially, an eating disorder is characterized by somebody being obsessed with food, weight, body image, and how food and eating may affect that. In bulimia and anorexia, it's very, very control-based. People may feel like they're out of control of their lives, and the one thing that they can control is their food and their eating. It's very difficult for people to understand eating disorders, so I'm going to try my best to explain it to you. Most addictions it's very, very common that addictions are developed during adolescence, because this is a time in our lives where we want to fit in socially, and addictions tend to be a maladaptive way of coping with feelings and social situations and so on. And eating disorders is one of those things. I personally developed anorexia when I came into standard 6 when I was 13. I didn't realize what I was doing at the time. I didn't have a name for it. All I knew was that I wanted to lose weight. I had a lot of things that were going on in my life that were making me feel like I wasn't good enough. There was something wrong with me. I didn't feel in control of my life. I didn't feel in control of anything really, and I didn't feel like I was good enough. So I thought that if I were to lose weight and maybe be pretty, I could be more socially accepted and all the rest of my problems would be solved. It's a very juvenile way of thinking, but at the age of 13, your brain isn't fully formed yet, and it made sense at the time. And unfortunately, that belief system has now become very deeply ingrained with me. I look at addictions a little bit like a cancer, in the sense that there are stages. The early stages are easier to treat, and if left untreated, they will progress into something that is harder and harder to treat. The same with the actual tools that are used for the addiction and the payoff and so on. In other words, so when I first started my anorexia, I simply restricted and restricted and restricted, and I got a huge high from losing weight. I started getting affirmation from people around me, and I set myself a kind of a target, an aesthetic target. I don't recall it being an exact weight, but I figured that this was something that I was going to do temporarily until I looked a certain way, and then I guess I would stop doing it. And this is very, very common. It's not an intentional thing to decide to start to have an eating disorder, because it's a horrible, horrible, horrible thing to develop. So I don't think people sit down and go, I know what, I'm going to start being anorexic or bulimic or binge eating. It is, as I said, a maladaptive coping mechanism that over time grows into a monster. So what tends to happen is that people will set like a goal weight or something, and they think that they're going to just stop it then. But the problem is that after acting out in these behaviors for weeks, months, years, they become very, very, very deeply ingrained belief systems. And what also starts to happen with anorexia is that you start to become very body dysmorphic, and you lose the ability to clearly see what you look like. So that weight may come and go, and you still become fixated on the idea that if you are to lose weight, it will make all your problems go away and things will be better. And you are unable to start seeing that you're actually underweight. People get very frustrated with anorexics because they're like, can't you see what you're doing to yourself? But the reality is we actually can't. We might be able to get like small like glimpses of reality, but generally the deeper you get into it, the more incapable you are actually of seeing yourself accurately. So if you do know somebody who's suffering, try to be patient and empathetic, because it is a real disease. And I have actually watched a friend of mine, Danielle, who I was in treatment with, literally starve herself to death. And the reason for this is because she became so terrified of gaining weight that her brain literally was incapable of seeing the reality. I don't think she realized that she was actually killing herself. So it's very difficult, and it's very scary to see. If you know somebody who needs help with this, it can be very tricky to approach them, or if you yourself are suffering. It is a very shame-based disease. There's a lot of shame, there's a lot of secrecy, there's a lot of hiding and a lot of manipulation. One becomes quite convinced that in order to be loved and accepted by society or by friends, you need to either remain skinny or become skinnier. So it becomes like a full-on survival mechanism, which is why when you approach somebody who is anorexic, they will generally get very defensive, they'll deflect, and they will hide, and they will do pretty much anything that they need to do to prevent you from taking them into treatment and taking their disease away. As a result, sometimes people just stop confronting the sick person because the fallout becomes so massive. But the problem is with that is that, as I said, with this cancer, the longer left unchecked, the harder it is to treat. And after a while, the anorexic is no longer getting any joy whatsoever from losing weight. They become enslaved to this inner demon, for lack of a better word, that is just constantly this voice inside your head that's just constantly like telling you that you need to be careful of eating, and you need to eat less, you need to lose more weight. The obsession grows, and it literally starts to eat the person alive. It's horrible. So I don't advise that you take it on yourself to help somebody who you can see has got a problem. You need to approach a mental health professional or a number of them. The treatment for eating disorders is usually an inpatient program because with process addictions, it involves so many things. It might involve exercise. It's not just as simple as the person needs to eat, because it's more than just about the food. They need to go through very, very, very intensive therapy, and they also need to go through nutritional rehabilitation. So there needs to be a team of people helping the person. So if you, as I say, if you are struggling, or if you know somebody who is struggling, the best thing to do is to reach out to a rehabilitation facility and get an intervention, so that the person can get the help that they need. And be prepared for a backlash. They're not going to be happy about it, but at the end of the day, you are saving a life. Because out of all of the addictions, interestingly enough, eating disorders has got the highest mortality rate, and out of all of the eating disorders, anorexia has got the highest mortality rate. This is due to bodies just giving in, and organ failure, and also due to suicide, because of how absolutely ghastly it is to be trapped within an anorexic addiction. It's horrible. So as difficult as it may be to get the person that you love the help that they need, just remember that this really literally is a matter of life and death. So I hope this could help you understand a little bit more about it. And again, if you want me to answer any specific questions, you're welcome to comment or email me, and I will try to help out the best I can. Yeah, thanks guys. Have a lovely day further, and I will chat to you soon.